She's Chris Wood, registered nurse. Just keep recording. It's actually a good take. It's a good take.
Hi, it's just important. It's customizable.
It was the popes and the noblemen because they had enough to eat, and in fact, that's how it was documented originally. Welcome to Wellness Wired with two docs and a nurse. This is our podcast talking about the beginning journey into the biohacking arena, which many of you may have heard about through social media or your local water cooler conversations. Before we get started with the information in this podcast, I want to mention that any information we discuss in our podcast is for educational and entertainment purposes only. It should not be considered as medical advice, diagnosis, or treatment. Always consult a qualified healthcare professional before trying any practices discussed, such as techniques we may mention in this podcast. We are not responsible for any adverse effects or outcomes from applying this information. And with that, I'll go ahead and introduce myself. I'm Ludwig Sardarian. I'm an anesthesiologist by trade, and I am a deep lover of all things biohacking.
I'm Chris Wood, holistic health nurse by passion, nurse by trade, and this is definitely the icing on the cake of my life.
And I'm Dr. Narayan Kulkarni. I'm a wounded hyperbaric medicine physician, and I am absolutely in love with integrative medicine and all things about integrative medicine.
With that, I'll have you kick it off.
Started. All right. So we're going to kick this off, our biohacking, talking about cold water immersion. So I know this is one of your most favorite biohacks. So why don't you walk us through the origins of cold water immersion and what's some scientific evidence to support its effectiveness?
No, absolutely. Cold water immersion is not new at all. It actually dates back to 3500 BCE to Egypt. You have even documentation in Rome, and Hippocrates wrote about it in ancient Greece as well. Cold water has generally been a treatment for fever, pain ailments, headaches. It is not a new concept at all. A lot of literature from French surgeon Baron de Lorey, who used to use ice for pain numbing before amputations. And so really in the 19th and specifically end of 20th century did we start to see it in athletics. And the current day, I would say, popularity really comes from social media, but also athletes using it enough where there's empirical data behind it. But truly, I would say the recent historical data is mostly from the Nordic countries, Norway, Sweden, Finland. They've been well known for their study of saunas, but now cold water is being studied in a similar fashion. The data isn't as robust as it is on saunas, but very similar pathways. So very exciting to see this being adopted by a lot of folks.
So walk us through some of the mechanisms for which the cold water immersion provides health benefits.
Sure. To understand how shock works in good and bad ways, it's really understanding the physiology of the body. And there are nuances which we'll address between males and females and age-related. People think of shock typically as car accident, bad news, and your immune system gets depressed and you get sick. Or even worse yet, your system can collapse. This exposure to cold water causes a shock experience that is manageable and is not damaging to the body. So what happens when you have a exposure to specific range of cold water under safe conditions is the body releases what are things called cold shock proteins, and they are specific, if you can call them, almost like centurion knights and back in the Roman Empire. They seek out malformed proteins, they seek out bad DNA components, they seek out anything that is potentially putting the body in a state where bad things can happen. So when you're in cold water, your body's getting you prepared for hypothermia. It's getting your body prepared for something bad to happen. So it's going to try and protect the main organs, your liver, your heart. And so these cold shock proteins really go out there and they scavenge quickly. They slow the heart rate down. They get the immune system prepped. And so if you can think about a system that immediately deletes anything that is not necessary in the body, That's what cold water immersion does if you do it the correct way. It's very important for me to state that you can go overboard with these things, right? People that are getting inside of basically a block of ice for long periods of time, that shock, now you are damaging the system, because now you're causing a cortisol release that is damaging. And there are nuances related to male and female exposure as well. However, generally speaking, if you stay within the parameters that have been studied, which is 50 to 60 degrees Fahrenheit for 11 minutes a week, very, very big benefits on immune modulation, which is your immune system is healthier. Glucose tolerance, it causes your insulin receptors to behave better. So folks that are on the brink of diabetes, it improves with that. There's a lot of anecdotal data of folks not having the common cold anymore. I mean, knock on wood, I can state for myself, it's been a year since I had any type of a cold, and I've been cold plunging pretty routinely. And then, of course, inflammation. That's kind of the big buzzword now in all things bad, and it's a powerful anti-inflammatory because it's cold. You cause massive vasoconstriction. The cold shock proteins go to work. Your body goes into a survival, and the inflammation in your brain goes down, which has huge impacts to dopamine. So there's a massive mental health component to it. And then when you get out and you rewarm, naturally you shouldn't go under hot water. You should let your body. That vasodilation is a very healthy arterial process that your body goes through. So it's actually a beautiful process.
Yeah. So let's talk a little bit about some of the indications, like who should and shouldn't.
Sure.
Did you cold water immersion, the difference between men and women, some of those things?
Yeah, by and large, there aren't a lot of strong studies specifically, for instance, for pediatric patients and adult populations or heart disease. So the recommendations are more or less anecdotal in nature when they give it. However, there's a lot you can extrapolate. Again, I'm an board certified anesthesiologist with a heart problem, so I fit the mold of a high risk patient with the heart issues. The data out there states that if you have any major cardiac issues, heart failure, or significant arrhythmias, and I'll add my 2 cents on this. Arrhythmias that cause your heart rate to be too low, in my experience and my clinical knowledge. Because when you go into cold water, your heart rate slows down. So if you have a situation where your heart rate is, you tend to have orthostatic hypotension, you pass out a lot, you got to be careful with cold water because it can induce that. I've been asked a lot about people that have Raynaud syndrome or any type of vascular issues. I have not seen data as a contraindication. It's mostly anecdotal neurologists saying you shouldn't. I will say my son, who anecdotally neurologists had said he had this and that, maybe Raynaud's and maybe some juvenile rheumatoid with didn't come true. He's benefited greatly from this. So I think there's a safe way to do this, and I'll speak to that. And for women, the difference between men and women is men and women are very different physiologically. Men tend to tolerate temperature variances a little bit better. It has to do with muscle mass. It has to do with the cardiovascular system. Females, because of the menstrual cycle, can have greater or less susceptibility depending on the time of month, or if they are trying to have a child. There's a lot of components, nuances with female exposure. So when it comes to the difference between male and female, the recommendation is females should enter the cold water immersion with a little bit more caution. Start slow, slowly expose your body. The caveat being, the entire experience has to have a shock to it. It can't be a comfortable experience. I always say biohacking is not a comfortable process. It's to expose your body to things that it otherwise wouldn't, and hence have a response that's healthy for you.
Do you think also like your thought process in going into it, if you for example, this is going to be so cold and you're like tense and kind of work yourself into it, that you're not going to get those same positive like you're not going to get the same positive dopamine hit and positive outcomes if you're kind of going into it in that like negative, versus if you go into it like it's going to be cold, it's going to be miserable, but I'm going to get through this and I'm going to come out better on the other side.
That's a great question. I don't know what the exact answer is, but I do know part of getting into cold water or in a sauna for a long period of time is your body, your brain is going to tell you, you need to get out of this. This is not normal. I want to just go under my blanket and stay warm. But comfort is not a great thing for survival in general. So whether you go into it saying, like, I enjoy going in it now personally. However, like this morning, it was early in the morning. It's kind of cold outside now. I was like, do I really want to get into this thing at 5 in the morning? But once I was in, I was in. So fighting the urge to keep yourself out of a uncomfortable arena and then mastering it, that resilience is very powerful. And there's a lot of talk about the anterior mid-cingulate cortex in the brain and its importance in resilience and grit. And so when you're doing something that you don't like to do and you fight through it, there's something very survival impactful in that. So yeah, eventually you get into the routine, but the whole goal is that every time you're going in, you think twice and you're like, oh, it'd be so much more comfortable just to put a nice sweatshirt on and go and drink some tea. But I'm going to do this because it's good for me.
So that's something we talk about when I teach yoga classes and I teach hot yoga.
Yeah.
And it's miserable, right? In the heat of the moment, no pun intended, you're like just miserable. Do I have to do another posture? Do I have to hold this? And I always taught it as you're learning how to find peace in the chaos.
Yes.
And if you can do that on the mat or in the cold water, and you can find your body wants to like panic, but you can control it, then when you have that chaotic situation that you can't control, you've already made those neural connections. Your body already knows, oh, I'm in that panic state, but that's okay. I know how to breathe through this, or whatever your kind of coping mechanism is through the cold plunge or the hot yoga, as the case may be. So
you could probably extrapolate that to any stressful situation.
It is.
Even outside of the water, outside of a hot class.
Sure.
It's just as soon as you're in a stressful situation, you've already conditioned yourself to
Absolutely.
control.
Yeah.
Right.
You're mastering your sympathetic system.
Right. You're mastering your
You've
sympathetic
experienced
system.
it before already.
Correct. Yeah.
Especially if you do it in the morning. You kind of started your day setting the tone for your mind to say, hey, I can master this, so I can master that email that doesn't go my way, or I can master the fact that my gas tank is a little bit low and I'm worried about running out of gas.
Yeah.
Does that affect sleeping at all? Is it best to do it in the morning versus evening with that norepi surge?
Yeah, so cold water immersion.
The quality of sleep.
I think theoretically it should impact sleep if you do it at nighttime. The norepinephrine, it's a sympathetic driver.
Sure.
So here's my point. Do it whenever you can, right? If you can't get it in the morning and you're going to say, well, the doctor told me not to do it at nighttime, so I'm not going to do it. No, do it anyway. Do it at nighttime. The anti-inflammatory aspects of it, the dopamine increase will benefit your sleep. Now, if you had a choice to do it between night or day, try and pick a day and try both. It's profound how much clearer minded I am if I do it in the morning than at nighttime. But if you're going to get into the nuances of percentage of deep sleep and REM, you may see some differences and not get as much deep sleep at nighttime. But do it whenever you can. I would say don't cut it out.
Yeah. I think that is pretty similar to HIIT training. The same kind of grit. You need that same grit.
Absolutely.
You need that same consideration. Like, does it feel better at night to just wear out all that energy and everything that's built up from the day, or is it better to just do it 4:30 in the morning on a Peloton where I'm like, all right, now I'm ready to crush the day.
Correct. Yep.
Speaking of HIIT,
so
this is really what I've been fascinated with recently, especially learning about the Norwegian 4x4.
Sure.
Just tell us what exactly HIIT training is, what does it stand for, and how do you do it?
Absolutely. So HIIT stands for high intensity interval training. So basically it is an exercise program where you are combining short bursts of very high intensity exercise followed by longer periods of rest or low intensity exercise. So you're pushing your body to its maximal effort, and then you recover for a certain period of time, and then you repeat the whole process again. You can do that for any type of exercise. You can do it for running. You can do it for swimming. You can do it for the elliptical. So you can spread it over, or it can be applied to multiple different types of exercises. A typical HIIT program, say for a beginner, would be like a 5-minute warm-up, and then 30 seconds of increased intensity, whatever that looks like for them, and then 90 seconds of lower intensity. And then you would just go back and forth and back and forth. You would do that for about maybe 20 minutes or 30 minutes, depending on what your comfort level is and where you were beginning. And then after that, you would be done. And then again, you customize that program for yourself.
Outstanding. Just from a molecular and hormonal mechanism standpoint, what's at play when you're doing HIIT training?
So this is really fascinating, and there's a lot of overlap too with what Chris is going to talk about with intermittent fasting. There are several different molecular and hormonal mechanisms that are involved. One really cool concept is HIIT actually promotes mitochondrial biogenesis, right? Very cool word. So basically you're producing a lot more mitochondria. And for those folks who may not know, mitochondria are your energy factories in every cell. And HIIT training actually increases the numbers of mitochondria, and it actually increases their efficiency through special pathways to those neurons. It's actually called the PGC alpha 1 pathway. So it actually increases the numbers of bacteria. And then during HIIT training, you're going back and forth from anaerobic respiration to aerobic respiration and going back and forth. So when you're in that high intensity period, you are going into anaerobic respiration, meaning that there's not as much oxygen available. And when there's not as much oxygen available, your energy levels go down. So that actually triggers another pathway called an AMPK pathway, and that promotes fat oxidation and glucose uptake into the cells. And that's the similar phenomena to of metabolic switching that Chris is going to talk about. In terms of hormones, the glucose transporters in the cells actually become activated, so you become more insulin sensitive. The catecholamines, which are adrenaline and norepinephrine, actually promote lipolysis, again, which is fat breakdown. Growth hormone levels increase, so that promotes muscle repair, muscle hypertrophy, and also promotes fat metabolism. So you keep on coming back to that fat metabolism thing. And then your endorphins grow. And anybody who's been on a pretty decent run knows how good they feel, right? Yeah. So it's not just your endorphins that grow up, but actually your BDNF, which is your brain-derived neurotrophic factor, which is also a chemical that is produced by the brain that protects the brain from neurocognitive disorders, but also is involved in your mood as well. Yeah. So actually helps you feel better. The cool thing about HIIT is during a period of HIIT, after you're done, you go into something called oxygen debt. Yeah. Okay? And that oxygen debt means that you've gone into so many periods of anaerobic respiration where you're not using as much oxygen, that as soon as you're done, you actually are, the body is spending a lot of time trying to make up for that oxygen. So it's spending a lot of energy to burning fat to go back to where it used to be, right? And that is a really cool part. And that's called EPOC, or excess post-exercise oxygen consumption. So really cool concept. It's actually also known as afterburn.
Afterburn.
So that's what everybody considers.
That's what we call it in the gym.
Afterburn. So you're in that afterburn phase. So nice. It's pretty cool.
How does HIIT compare to traditional cardio training for fat loss and heart health?
So they're both excellent. Yeah. They're both really, really good. But I would say that when it comes to HIIT, that you are really you're getting more bang for your buck. Yeah. Okay. It's efficient, right? Because you're conducting the program in a shorter period of time. Very focused on fat loss, right? So like I said before, a lot of mechanisms are focusing on fat loss, a lot of fat burning. You have the afterburn effect that we talked about through excess post-exercise oxygen consumption. Tongue twister there. You've got the improved fat oxidation through these AMPK pathways. So it is ideal for fat loss in a shorter period of time. Yeah. But for the cardiovascular system, this is where really a lot of the good data for HIIT exists, that it really dramatically improves something called your VO2 max.
Yes.
Okay, that's where some very, very decent data out of Norwegian countries like Norway. So what is the VO2 max? So the VO2 max is it's a measure of how well your body uses oxygen. It basically measures how well the heart and the lungs and the muscles are all using oxygen together. And that all comes from those periods of we are going into anaerobic respiration. So the body learns that when oxygen is available, I really have to do the most with it. It improves heart efficiency as well, improved stroke volumes, and I just learned about a study today where they actually talked about an improvement in the actual structure of the heart. Yeah, it was a 2-year study out of Texas.
50-year-old males.
50-year-old males, and they just compared a group that just did stretching exercises and a group that did 2 years of HIIT programs, combined with strength training and some stretching as well. They found out that there was the cardiovascular structure went back from a 50-year-old down to a 30-year-old.
Yeah.
I find that absolutely remarkable.
And that's kind of the magic time frame longevity experts are talking about, right? Is that extra 20 years of giving yourself a quality life.
Yeah, and that's just, again, primarily through HIIT training. You also get benefits through endothelial function.
Yeah.
So basically the vessels are working better. They're more elastic. There's more nitric oxide that's produced, and that's a chemical that helps with vasodilation. So that actually has shown some improvements in blood pressure.
Yeah.
And when it comes to blood pressure and arterial flexibility, that's, elevated blood pressure is, as we all know, is significantly linked to a lot of chronic medical conditions like cardiovascular disease and stroke and that sort of thing.
Yeah.
So the summary is, with HIIT training, it's faster. There's higher caloric burn. You're getting mitochondrial biogenesis.
Yeah.
You're getting VO2 max, which is improved, and possibly even muscle gains. So the best way is really to do HIIT a few times a week, and then combine it with the rest of the week doing regular cardio studies.
I think that study you were mentioning, I think it was out of Northwestern, about the 50-year-old man. I think they did one day a week. Well, of course you can do more, which is fascinating. That just 1 day a week for 2 years made us. Can anyone start on a HIIT program?
Short answer is yes.
Yeah.
Short answer is yes. So it's a framework. You customize it, right? There's no rules. So if you're an athlete, obviously your idea of a HIIT program is going to be very, very different from somebody who's a beginner or who's a very, very sedentary. An athlete, for their HIIT, their high intensity might be sprinting, whereas a beginner, you could just do brisk walking.
Sure.
The cautions for HIIT training are those with coronary artery disease, hypertension, diabetes, joint problems. So you always want to talk to your doctor, make sure that you discuss it with them, get clearance, maybe even have them supervise your sessions for a while. And again, don't do it for more than 2 to 3 times a week, because after that you actually go the other way and your cortisol levels will start to increase, and you'll actually potentially the fatigue will start to set in, and you'll actually muscle breakdown will actually start.
I do want to make a comment a little bit about that, the getting professional guidance, because I think it is very important. However, there's a phrase that I've come up with. Everything we talk about in our podcasts and our biohacking specifically, it's probably not going to be your primary care doctor's cup of tea, at least the current day, right? I think 5 to 10 years from now, this is going to be embedded, as Peter Attia famously says, has coined it, medicine 3.0. So, yes, absolutely check with your healthcare professional. However, do not use it as a crutch or an excuse not to go outside and walk, right?
Sure.
I have a heart problem. I have a bad knee. You need to get out there. And then, there's a phrase I love, that comfort is the enemy of progress. Comfort is also the enemy of longevity. It's also the enemy of not getting cancer and all that stuff. So you have to put yourself in an uncomfortable position. So
high intensity is going to vary with your age. It's going to high, and it's just in quotes. It just means
it's a heart rate max, right? How you get your heart rate up.
What is high for you? It doesn't have to be.
And oftentimes, just doing a simple walk or a simple outside your comfort zone may elucidate a heart problem that you have that you wouldn't know otherwise.
I've done HIIT studies on 70-year-olds.
Absolutely,
with good results.
Related to discomfort, I forgot to mention one thing about how. People think of cold water immersion, cold plunging. They think of ice. They think of sitting inside of their bucket of ice where their beer is sitting. No, it doesn't have to start that way. You can just fill your tub. You don't have to buy expensive things. Fill your tub up with tap water and try and get in there. And if you can do that, and that's going to be cold because you typically don't sit in water that's cold, then you incrementally make it colder. Again, this is all about access and being able to do it. Not I got down to 33, 32 degrees, look at me. So really it's about being able to do it, and you don't need the fancy equipment. This is a very simple thing. So I highly recommend it from that standpoint, from an accessibility standpoint.
I think that's true for HIIT training as well. You
Yeah.
don't need fancy equipment,
Absolutely.
you
No.
can go for a walk
You
and
go
then
for a
speed
walk.
up your walk, or
Right.
turn
Absolutely.
that
It's
walk
it's
into a jog.
customizable.
Clock
Right.
yourself. See,
Yeah.
like to go
Right.
around my neighborhood, it usually takes 12 minutes. I'm going to do it in 8 minutes.
Right.
It's really cold outside.
Yeah.
You can do jumping jacks.
Yeah.
So you do full jumping jacks, and then you switch to like the tap jumping
Absolutely.
jacks, and so you're high and low. So there are things you can do inside your house. Anything that's going to increase that heart rate, and we're working on that VO2 max, which is
Yeah.
direct correlation to all-cause
Direct
mortality.
correlate, yeah.
So things that you
And there's more and more,
Can do.
speaking of VO2 max, more and more wearables now that will try and calculate
Mm-hmm.
a relative VO2 max. So you'll have that data point as well.
Right.
So
There
I
are some simple calculations on the internet that you
Yes.
can use just to use the time that it takes to, for example, run 1.5 miles, and just plug that into a formula, and that'll give you a rough VO2 max as well.
I can totally see this as being like a high school jock thing where they're like, my VO2 max is better than yours. And I got to 55 VO2 max. So
Right.
it's interesting how much things have changed
Sure.
in medicine. Speaking of something that has not changed, but I would love to hear about intermittent fasting.
All right, so now we're going to move into one of the most talked about wellness strategies about wellness, which is intermittent fasting. We'll talk about the science and its benefits and how you can tailor it into your lifestyle. So Chris, what generalized benefits does intermittent fasting actually provide?
Yeah, so I think if we can take intermittent fasting back to its roots, which is really back to the dawn of man, we've intermittent fasting out of necessity, kind of in one way, going back to caveman years. Did we know where our food was coming from? When are we going to eat? And then even through religious experiences, most of your major religions have a fasting component to it. And with that, with both of those components, you in that fasting state have an opportunity to think more clearly. You're more agile. You're more aware of what's happening around you. You have an ability to kind of integrate with the environment around you a little bit more deeper into your thoughts. So there's this very clearing of the mind and body that kind of comes out of that millennia of fasting. And so I think that's kind of where we want to kind of angle the thought process. And so what happens is we have this improved cellular turnover. This is where the body is repairing either damaged cells, it's repairing them, it's getting rid of them, it's focusing down at that mitochondria level, again, that powerhouse of the cell. We're really cleaning out the waste and using every cell as efficiently as possible. It helps to improve insulin sensitivity, so your blood sugar is better controlled. You're reducing that inflammation that we've talked about a number of times. Excess fat storage, particularly around the midsection, you really help to get rid of that, and that is so wrapped in inflammation and blood sugar control and hormonal control and blood pressure. The lining of the gut after a certain number of hours, we'll talk about a little bit further down the road, is improved. So you have improved gut lining, you have improved gut microbiome, you have improved absorption of what you have already eaten. Neurotransmitter production. So a lot of your neurotransmitters, those foundations are made in the gut. So as you're improving gut lining and gut health and gut microbiome, you're improving the ability to make those foundations of your neurotransmitters, and then you're also improving that uptake and receptibility as well, or sensitivity to them. It helps to remove toxins and waste from the body. From a medical standpoint, we know this, right? Somebody has a small bowel obstruction, we put them on bowel rest.
Right.
So the body can just take some time and do its kind of normal peristalsis and out. So a lot of those different health issues that intersect just by giving your body some time to relax. Digestion itself is such an energy heavy process. When we take that component out, the body really has a lot more space to do what it needs to do to repair itself.
So lots of generalized health benefits. Or are there any specific health-related concerns that can be improved with intermittent fasting?
Yeah, so a lot of endocrine functions. So we're looking at blood sugar control, we're looking at hormone control, and that directly relates to blood pressure. We're looking at mood stabilization. We're looking at even cancer patients. There's a study that I read recently where they put cancer patients on a fasting schedule, and it helped to reduce the size of the tumor and reduce metastases as well, which is amazing. A lot of the thought is that those cancer cells really feed on sugar, and so we're taking out that component of just feeding those cells and basically starving them. So then that you can go in, do the cellular cleanup, and get rid of them. The midsection, that
Huge.
it's huge, and it is another one of those correlations to all-cause mortality. The more that you carry around the midsection, the more higher risk. And again, then that's inflammation, that's blood pressure, that's blood sugar control, all of those cardiovascular health risks that come from that. And a lot of that then, particularly as you move into mid-age, is hormone related. But those hormones get so dysregulated by all of those other issues. There's improved triglycerides, improved overall cholesterol regulation, increase in the BDNF that you talked about earlier, those catecholamines. Improved mitochondrial function is really the base of all of those health issues.
Fantastic. So with intermittent fasting, people often hear the term the sentence, you are switching from sugar to fat for your fuel. So how does intermittent fasting actually change the way the body uses energy for metabolic function?
Yeah, so your body can use energy in two different ways. You have a sugar burning and then a fat burning process to utilize energy. Our very sad standard American diet is heavily based in that sugar burning.
Yep.
And if you think about it, that's the person that has to eat every 3 or 4 hours.
Yes.
They get hangry, right? They get the brain fog. Their inflammation is usually pretty high, and they're the person that's going to get their coffee and their muffin, and it's very sugar based, and so your body uses whatever it can in the moment. That sugar burns it immediately, stores anything extra as fat right around the midsection, and then it's all gone, right? So you're hungry again, and when you're ravenous hungry like that, you're reaching for something that's going to give you that quick spike back up, so you just continue that cycle. Versus the fat burning cycle, which starts to break down ketones for energy, which is much more effective for heart function. Your brain loves ketones. Those endogenous ketones have been shown to improve structure and function of the heart, as well as cognitive thinking, all of those pieces. So you're looking at about 12 to 14 hours without food to switch over into that fat burning or utilizing ketones. This is not full ketosis, but still switching from more sugar to fat burning. Your blood sugar will drop as ketones increase. This is your hunger signals. They start to turn off. You start to begin to repair yourself, the autophagy, clearing out those cells that are either damaged or unrepairable. That starts to begin. Neurotransmitters, neuroepi, GABA, those are all released. You get this sense of calm, relaxed state. Again, mitochondria.
Right.
They run on ketones. They actually don't use glucose. They use ketones to do all their functions. So if we're looking at how do we improve the body, we go back to this. Every single cell is run by the mitochondria. You're feeding it the best food that you can to do its function in the best way possible.
Flashback biochemistry.
Yeah, I know. What's fascinating about fasting is if you actually study the evolutionary makeup of the human, right? We are designed to survive starvation.
Correct.
We are designed to go through a famine and make it out healthy and reproduce, right? We are not designed to be obese. We are not designed to have food ordered and delivered to us and 3,000 times the glucose and sucrose and fructose levels in our body. Our body doesn't know what to do with that. So the autophagy you talked about, which is the clearing out of the system, that shuts down.
Yeah.
Because the body's like,
it's so overwhelming.
we don't know what to do. So the entire system that we're built on for survival and longevity and health basically turns off because they're like, well, we have nothing to work on here.
Right.
Correct. Yeah.
Right. And as we talked about at the very beginning, right, this makes sense because let's see, you're out there hunting,
Yeah.
right? You're hunting for the
You
gazelle.
may or may not catch something.
The gazelle is really fast.
Absolutely.
Right? So you have to be agile. You have to
Right.
know what's happening around you because the lion is also hunting you
Yeah.
and the gazelle,
Mental
right?
acuity.
So you are mentally sharp
Yep.
and ready to go. And it is essential for you to be able to take in all of that and function just rapid fire. Yeah.
What's fascinating is that diabetes was originally the disease of the aristocrats. You know,
Yeah.
it was the
And
popes
gout.
and gout. It
Yeah,
was the
yeah.
popes and the noblemen
Right.
because they had enough to eat, and in fact, that's how it was documented originally. And then now it's the common person's
Now it's-
disease.
So let's make it practical because there's so many variations of intermittent fasting. What are some common intermittent fasting schedules? And is one better than another?
Yeah, so I think the most common, what we've most often hear about is the 16 and 8. So that's 16 hours of fasting and 8 hours of eating window. And I'll say this caveat at the very beginning. Just because you have 8 hours to eat does not mean that you
Right,
eat anything that you want. You still really need to look at your diet and make
Avoid
sure
that
that you...
compensatory overeating is what we
Right.
call it.
Right,
Yeah.
right, for sure. So you need to make sure, like it is foods in their most natural state, as many colors in the day as you can, really staying as close to the source
Low on the food chain.
as possible. There are other fasting cycles. There's a 5 and 2, so you eat normal for 5 days and then 2 days of very low intake. There's variable intermittent fasting, so that's where you fast every day, but you fast at different time lengths.
Yeah.
So one day you may fast 15 hours, and then another day at 20 hours, and then another day maybe just 8 hours. And it's thought for women that's actually the best. Men tend to do really well at that 16 and 8. Women tend to do a little bit better with the varied intermittent fasting. Mostly related to hormonal changes, and kind of on that as well. There, as you move through that menstrual cycle phase of life, and then even into postmenopause, you're still going through cycles where you really kind of want to be a little bit more cautious and have a little bit more nuance in how you're fasting.
What about age considerations? You mentioned gender.
So a little bit, yes and no. So age considerations, young, like prepubescent, they are rapid fire growing. I would not recommend a child to do a fasting schedule. Their caloric need is so much.
Especially the neurologic development that they're going through.
Absolutely. Same thing for pregnancy. Your caloric need at that point is so high to fast I wouldn't recommend that. In the elderly, the same thing. Your caloric need is much different. There's a lot of medications to consider as well, so that would be something
Brittle
that...
diabetics,
for sure.
Yeah.
Overall, for kind of your middle-aged general population, I think you can use any fasting schedule that feels right, that fits best with your life. If you're a day shift or night shift worker, as you get into longer fasting hours, we kind of look at that 16 and 8, but at about 17 hours, that's really where the autophagy starts to happen. At 24 hours, the gut really starts to repair itself. At 36, you're looking at full fat burning. That's where you really are getting into ketosis. At 48 hours, you have a full dopamine reset that happens. And if you get into 72 hours, your immune system resets. And this makes sense, right? If you think about, you have a stomach bug, you're not eating for 24 or 48 hours, right? Your body's resetting. You have the flu. You typically don't eat for 2 or 3 days. Your immune system is resetting itself. So it sounds like this really kind of out there new concept, but your body is already naturally doing it. And what...
it's in our program.
Yeah.
It is.
It is, and it's really programmed into us. And I think once you get into these routines too, your body will start to tell you, like, today I need a shorter fast, today I need a little longer fast. Kind of start to get into a rhythm and recognize your own body. A good plan in your fasting time, we kind of talked about it briefly. You want to eat as many foods in their most natural state as close to the source. Your protein consumption, you really want a 1-to-1. If you're trying to gain muscle, you want like a 1 to a 1.5, which is 1 gram of protein for every pound of lean body mass, or a gram and a half per every pound of lean body mass. For carbs, you want those as low glycemic index carbs.
Right.
So you're not raising your blood sugar up and getting this huge spike. So you're looking at fruits and vegetables on that lower glycemic index scale. And really making sure that the bulk of your calories are coming from protein and healthy fats. I know particularly for women in their mid-40s, as I may or may not be, are really afraid of fats, right? And we don't want that extra fat, but those healthy fats coming from your lean protein sources, your meats, avocados, nuts, those sort of things really do help to build it's building blocks of everything, right? All of your amino acids, your proteins that come from there, all of your neurotransmitters, all of that comes from those healthy fats. So if you're feeding what you need, then you give your body the space to use all of that stuff.
It's phenomenal. I think we've covered 3 very critical topics today. I think.
How about we end with one takeaway for each of these hacks?
Yeah.
What were your thoughts?
No, I would love that.
One takeaway for anybody who's listening or watching.
Yeah. So I'll do my takeaway, and I'm going to repeat this probably in a future podcast. If anyone's interested in longevity, which means, what does longevity mean? It means living well for as long as you can, so you have time with the people that you love to spend time with, right? People, I heard this Navy SEAL on one of the podcasts recently say, fathers that say, I'll take a bullet for my child. They're like, well, are you willing to go on a diet for your child? Are you willing to make yourself healthier? Because that child doesn't need you to take a bullet. They need you to live 20 years longer. So if you are accepting of that you want to have, again, we're talking about 20 more years of healthy life to give the people around you that love you. You have to understand that it's going to be uncomfortable, right? The decisions you make are not comfortable. It is not a drive-through. It is not eating as much sugary donuts as you want. It is not avoiding sitting in cold water or hot sauna or fasting or training. These are decisions that you have to make to live a longer, better life. And so the takeaway for me is figure out how to be uncomfortable, because then you'll find that balance that you may have been missing for a long time. And I think anyone that's listening to this podcast is probably seeking that balance.
I think there's no magic pill.
No.
And no one-stop shop.
Absolutely
not.
Not.
As we talked about today, so many of our things cross over, right?
Yes.
And so you need to be able to put the right ingredients in, to be able to move, to be able to make yourself uncomfortable, to all of those pieces build on each other.
Yes.
And so you really have to make a full plan, mental, physical, and emotional full plan to really get those benefits.
Yeah. There is a shortcut, but you still have to make yourself uncomfortable to go on that shortcut, right? There is no magic pill. So the shortcut is sauna, fasting. That inherently is a shortcut.
Absolutely.
But that there's that it's not unreasonable.
No.
You don't have to have fancy equipment. You don't have to go out of your way and spend tons of money and do these extraordinary things.
Absolutely.
That it's
you can do
manageable
today.
in your daily life.
You can do today.
I just want to echo your point that you are not going to get growth if you're going to stay comfortable.
Yes.
That's the bottom line. If you stay comfortable, there isn't going to be any growth, whether it's physical, emotional, or mental. You got to put yourself in uncomfortable situations.
Comfort is the enemy of growth.
It is. It really is. And then lastly, with regards to what we've talked about, it can be intimidating, especially for a beginner, especially for those who are not familiar, who've never exercised, who haven't exercised in decades. Start somewhere. Just start somewhere. Do not be intimidated by others around you who seem more advanced and more capable in whatever activities they're doing. Just start somewhere. Start eating well. Start eating more foods lower on the pyramids. Eat more leafy greens and vegetables. Go on walks. Even 10 minutes a day will be helpful. And then slowly work your way up. And then when you're in a comfortable plan in terms of exercise and diet, then start looking into these biohacks and see if that adds more quality to your life. And I think it would.
Absolutely. And again, as my disclaimer was, your local provider, your healthcare professional may not be up to date with Medicine 3.0. So figure out a way to do it for yourself and find pride in yourself. Give yourself credit. If you did go out for the first time and walked for a mile, be proud of that.
Mm-hmm.
To what Ryan said, don't compare yourself to the Navy SEALs that are at BUDS training. That's not the goal here. The goal is to continuously improve and find uncomfortable environments where you're suddenly saying, I can't believe I did this, I can't believe I did that. So this has been an outstanding podcast. Thank you, my friends. Our next podcast, which will be in this coming month, we're going to focus on some of the challenges around Thanksgiving with food and overeating, speaking of intermittent fasting, and just the overall decorum and discipline to how much we eat, what we eat, and just because it's a holiday. So
Also, when you go to the doctor and they throw all these numbers at you, let's
Right.
really kind of
LDL, HDL, all this other
let's
stuff.
explain all that stuff.
Yeah, we'll cover all that. So looking forward to having you guys back for our next podcast with Wellness Wires, 2 docs and a nurse. Thanks for joining.
Thank you.